Welcome to episode 229, Attachment Reimagined, New Perspectives on Reparenting and Clinical Work, featuring Dr. Judy Ho, licensed clinical psychologist. Make sure to subscribe to be alerted about future episodes. By Clearly Clinical. Learn, grow, shine. This episode is proudly sponsored by Berries, AI scribe for mental health, creating personalized notes and treatment plans. Try 20 sessions free at berries.icu. Hello to our listeners. My name is Beth Irias, and I'm so happy to be joined again by Dr. Judy Ho. Dr. Ho has joined us before in wonderful conversations about self-sabotage and also in the early days, how to cope with working through the isolation of the pandemic. I'm just delighted to have Judy back with us. Thank you so much for joining us again, Judy.
Thank you so much, Beth. It's great to see you again. I'm so excited to be with you.
So for our listeners who are not familiar with you or your work, again, this is Dr. Judy Ho. Why don't you take a moment and introduce yourself for us?
Thank you. Well, I am Dr. Judy. I'm a clinical and forensic neuropsychologist. I have a private practice. I also am a tenured professor at Pepperdine University. And I'm also an author. And my recent book is The New Rules of Attachment, published by Hachette Book Group.
Fantastic. So tell me how you got into attachment and how that's been something that's been a big focus for you recently.
Yeah, I think earlier in my training, I was very much foundationally more of a CBT therapist. That's a lot of where my interests lie. And I felt like it was so nice to have these practical strategies and tools that you can use right here in a moment. But as I continued along my career and got exposure to more and more patients and had more conversations, I realized that, of course, those here and now strategies are so important. But the patterns that people were unhappy with, that were repeating in their lives, that were causing recurrent negative self-talk, they were patterns that came from an earlier time in life that were cemented in their past. And it's not about, living in the past, but it is important to go back to see where the roots of those issues are if you want to truly eradicate these patterns from happening over and over again.
Thank you. I appreciate that. Attachment has had its place in the development of the psychology field over time. And I had the opportunity recently to speak with Dr. Sue Johnson, and she was talking about how attachment is one of those things that seems like we skipped over it, that we went through these times, like you said, of focusing really on cognitive work. And then right now we tend to be really body focused, neuropsych focused. And we haven't spent all that much time in this attachment arena. And I'm delighted to have you here today to shed a little more light on it, because it's so critical to how we interact with ourselves and interact with the world. And yet I feel like we don't talk about it very much.
Yeah, exactly. And I think that, again, it's great that there has been a focus on like body-based work, on those skills-based work that we talked about. And maybe it's harder to talk about attachment because it can feel a little bit more messy, like it's a little bit more complex to talk about it. It's a lot to unpack. So I think that maybe that's what's precluded it being more of a common part of the conversation. But I just realized that so much goes back to attachment and trying to find ways to unpack that in ways that feel still manageable for people, and like, oh, there's a solution, as opposed to, oh, I'm just learning all this stuff and then I don't know what to do with that information. Now I feel flooded with all this information that could be kind of challenging, and then I don't know what to do with it. I really want to, dispel that for people, that attachment work doesn't have to feel like just like a huge data dump and then kind of just sitting with that and saying, well, now what? I really want people to have some practical tools on how to deal with attachment.
I appreciate you bringing that up, because I feel like that has been something that I've thought about over time, is that attachment work is like, okay, really insight oriented, but then what? Like, it's like, okay, so I understand why I had this interaction with the receptionist at the doctor's office. Then what? Like, what do I do with it? So I'm looking forward to kind of the more practical aspect of it. Dr. Judy, why don't you start by breaking down some of the earlier attachment work and explaining about different attachment styles. And then let's go off of that into what you're talking about today and kind of new perspectives on
Yeah,
it.
absolutely. So John Bowlby and Mary Ainsworth were two of the foundational attachment theory figures who did a lot of the early attachment work beginning in the 50s and the 60s. And so what they realized was that these early interactions that babies, infants, and toddlers were having with their primary caregivers told us a lot about how the person develops over time, and that it has a lot to do with how they have relationships in the future, what they're likely to believe about themselves, right? But I think that over time, some of those messages got lost. And when you look at pop culture attachment theory work, um, oftentimes people are just talking about the applications to romantic relationships. And of course, that makes sense because you're thinking, well, the primary caregiver relationship, that's one of your foundational relationships. As you get older, what's the most intimate relationship that most people have? It's usually to a romantic partner. So maybe those patterns are showing up there. But I think that it misses a huge point of how much attachment really has to do with your entire life. It has to do with not only your romantic relationships, it has to do also with how you cultivate other types of relationships, from friendships to family relationships to collegial relationships, but also has so much to do with the foundation of who you believe you are, your self concept, and your belief in whether or not you're going to be able to enact positive outcomes in your life, not only in your relationships, but also at work, in your career, in your physical and mental health, and whether you even deserve good outcomes. So I think some of that got diluted over time, maybe because romantic relationships are just kind of, it's like a spicier, like more, trendy way to talk about attachment. But I just feel like so much of the foundational information got lost.
Yeah. I think that makes a lot of sense. And again, if we're going back in history, goodness knows that the original folks like Freud spent a lot of time specifically talking about romantic relationships, which is really a foundation for attachment of like, oh, this is why I'm doing this thing based on my early training. But you're right that it's so applicable to moment interactions with other people and the roles that we're assuming. For our listeners that maybe haven't looked back at attachment theory in a while, will you go over the different attachment styles?
Yes, definitely. So there are 4 attachment styles: one secure and 3 insecure attachment styles. And again, it's not always so easy to file people into one box or another. I have found that through a lot of my work in studying attachment and working with patients, that oftentimes people will find themselves maybe a combination of attachment styles, really. That maybe, for example, their romantic relationships, an avoidant type of attachment shows up, but then maybe in other areas of life, it's more of the anxious attachment. I think that that's also really common. So there are also some people who say, well, most of the times I am secure, but then maybe when I'm under stress, that's when some of the shadows of one of my insecure attachment styles come out. So I think that's all common. I think that that's another thing that maybe got missed a little bit in some of our more recent conversations. But people who have secure attachment generally, as they're growing up, they had primary caregivers who were generally attentive to needs, consistently showed up in the ways that they wanted, especially in stressful circumstances. And people with secure attachment then are more likely to hold themselves in relatively high esteem. They tend to have satisfactory and lasting relationships. They pursue individual goals while staying meaningfully connected with other people. And they generally believe they have worth and deserve good things in life. And people who have anxious attachment, in general, they may have had caregivers who were sometimes a little bit wrapped up into their own problems, or at times made their caring for the person seemingly a little bit conditional, so that the person felt like they needed to get more reinforcement to make sure that they were okay with these individuals, with these primary caregivers. And people with anxious attachment, they tend to crave closeness and reassurance in relationships as adults, but they also worry excessively about abandonment and rejection, and that can sometimes lead to clingy or overly dependent behaviors. People with avoidant attachment may have grown up basically being parentified children at an early age, taking huge responsibilities, maybe they were validated and supported and reinforced for their achievements. And so as they grow up, they tend to prefer more extreme independence. They might feel uncomfortable with emotional intimacy or relying on others. And generally, they tend to minimize the importance of relationships. And when they're under stress, they tend to kind of withdraw from their social world. And then finally, people with disorganized attachment, they may have grown up in really stressful, chaotic, and sometimes even traumatic environments as a child. So as an adult, they still find themselves constantly in a state of flight or flight. And generally, they have more struggles regulating their emotions. And as an adult, they may unconsciously replicate some of the chaos they experienced as children.
These four attachment styles have been around and identified since the early days of attachment theory. Have they been modified over time?
I think that most attachment style work over time hasn't necessarily been modified, except I think that there's been some misconceptions that have been cleared up. So, anxious and avoidant attachment styles, I think that they've sort of stayed pretty defined constructs. But I think there was a lot of understanding about the disorganized attachment style. So, in the beginning, early stages of the research by John Bowlby and by Mary Ainsworth, a lot of what I think was happening is there were these kids that didn't really fit into these other neater boxes in terms of their behaviors. And so they kind of all got filed into disorganized attachment. Like anything that didn't fit was almost like let's dump this into this category. And I think that was obviously a huge disservice because I think it was just like, well, this is the part of the research that's messy and we can't really unpack it. So like, let's just put this in this fourth category. And over time, I think it created a lot of misconceptions. Like, again, when you read pop culture work on attachment, you'll see that people sometimes think of disorganized attachment as like people who show both avoidant and anxious attachments, but that's not really true. I think if that's the case, then maybe you have a combined attachment, like I was talking about, that maybe they show up in different ways. Disorganized attachment really is its own category. And I think that what I have learned by really reviewing the literature and again, seeing how this manifests in my patients is that the most defining characteristic is that they're pretty much constantly in a state of fight or flight. And so when you're feeling that way, and it's kind of like your safety is always at stake. So it's a lot harder to self-actualize, to get to a point where you can say, oh, let me think about my self-esteem needs or like my bigger goals in life. Every day it feels a little bit like it's a life or death situation. And so the disorganized attachment individuals also have a harder time with a consistent coping strategy, whether it's a helpful or not so helpful coping strategy. So, avoidant attachment, their general coping strategy is to essentially avoid. They'll sort of escape from their emotional stress from committing to more and more goals. And then when they are under stress, they tend to avoid other people. They tend not to cultivate deeper connections, especially during those times. And then anxious attachment, their general coping strategy is to try to attain reinforcement as much as possible from their environment. So it's about, trying to get reassurance from people, maybe sometimes even being codependent, helping people more so than themselves, right? And that's the way that they're coping with their emotional stress. But people with disorganized attachment, they don't really have a coherent coping strategy. So they can feel a little bit more chaotic to others. Like they might act one way in one situation, but then later on in a similar situation, they act a completely different way. And so they're a little bit harder to predict. But I also think that over time, people have seen this disorganized attachment as, well, this is the no hope insecure attachment. Like you can't do anything about it, just got to deal with it. And, again, it's not true. Maybe the work will be slightly harder for people with disorganized attachment, but it's absolutely possible. And it starts with just regulating yourself and learning that base level of regulation so that you don't have to be in fight or flight so much of the time.
As you're talking about this, I'm hearing it kind of go alongside dialectical behavior therapy and these ideas about distress tolerance, mindfulness, and kind of settling things down, getting out of fight or flight. When we're looking at attachment styles through a lifespan, as you said, disorganized is usually the one that's associated with more, perhaps more chaos in different functional domains and also more sticky. more difficult to resolve, if you will, quote unquote. What does it look like for people with these different attachment styles to really work through it and get into a more secure
Yeah, I
place?
think the first step is just self knowledge, right? Like, I think that, like, as we talked about attachment styles, it can feel maybe a little overwhelming at times for people, a little bit messy. But it's really about being willing to take a look and say, you know, what is my attachment style? And knowing that if you have an insecure attachment style, that does not mean that this is, a kind of problem that's going to hang around forever. The first part is really just knowing that there is something to be done about it as soon as you have that recognition. And so I think the first part is really recognizing. And then the second part is, knowing that because your attachment style did form over a number of years, and for some people, even decades now at this point, it's not going to all get resolved right away, but with just a few daily exercises or intentional shifts, you're going to start seeing the shift. You're going to start seeing that things are changing. And so maybe it's not going to solve itself overnight, but you are going to be able to see measurable outcomes on a day-to-day basis, and just kind of reminding yourself of that and being patient with the process too.
You have really focused in on these different attachment styles and specifically some statements associated with each. Can you outline those for our listeners? Because I think they're helpful to help us kind of remember these stances.
Yeah, definitely. So what I find is that, again, we have our self-talk that develops from our experiences. They start from a really early age in life, even when we're not verbal yet. We just don't know how to communicate it, but our body, our minds, our souls, they know that there's certain lessons to be imparted in these early experiences. But over time, they do shift into these statements that tend to be operating at the base of essentially your conscious awareness. And these self statements, sometimes we call them core beliefs. That could be another way of talking about them. I call them self statements because they're basically statements about yourself and how you relate to the world. But it's almost like an operating system of a computer. It's kind of like at the base level of your brain's operating system. And people who have anxious attachment tend to have self statements that sound like one of these four statements or more. So for some people, they'll say, yeah, one of these really sounds like me. For some people, they'll say some or all of these sound like me. But essentially, for anxious attached, which is a type I also call like the worried warriors. Like, it's always about this over analysis and making sure that they're still doing okay in relation to others. Their self statements typically include one of the following: I'm not as worthy as others. I need to rescue everyone. I fear being on my own, and I have to analyze everything. And so generally that can lead to more clingy and codependent behaviors where you end up, putting everybody else's needs before yourself. And you're also sometimes fearful of, going forward independently without getting enough reinforcement and encouragement from your social world.
Thank you. So, with the anxious attachment, it's really about bouncing off of others in order to find our core sense of self.
Yes, exactly. And it's almost like you can't really sit with your core sense of self for too long. You kind of keep needing more and more reinforcement to be able to move forward. And so I think that can be what's difficult, is that for individuals with anxious attachment, they get that reassurance and it kind of feels good for a little bit, and then they have to do it again, you know. And and in some ways it kind of creates this negative cycle of, you might need more and more of it to feel secure over time. That might not happen for everybody, but in some ways it's almost like its own little addictive process. Like, you see this with addictions where over time the person develops a type of tolerance. They need more of that substance. It's almost like over time your brain needs more and more of that reassurance to feel better. And I think that that's when most people come to see me at my practice, is like, okay, this is getting kind of untenable now. I can't just keep asking for reassurance like 5, 10 times a day. Like, this is too much.
So, for the anxious attachment style, is a foundational part of the work development of self confidence and resilience?
Yeah, I think that in terms of self-confidence, where it also comes from, that it's more internally driven as opposed to externally focused. How do you feel good about yourself in the absence of everybody else being available just to validate you? And can you start to do things, a little bit at a time that are of importance to you, that can build self-confidence when you're on your own, as opposed to thinking I always need somebody to come with me. So I have a friend who, from a very young age, even if she was just to go and run an errand at a drugstore, she needed someone to go with her. Even if it was just like an in and out, like, just grab something real fast. And that's kind of what I'm talking about, is that over time, sometimes people don't really feel like they can even operate on their own, even so on some basic daily tasks. And so it's really about helping them with ways to do those things on a day-to-day basis and to feel really good about it and say, yeah, this is no big deal. I can do this, and I don't really necessarily need people following me around or coming with me at every turn.
Got it. Thank you. And moving on from anxious to avoidant, tell me about some of the self statements associated with that
Yeah.
stance.
Anxious attachment, in some ways, I think people almost think of it as like, well, it's the opposite of avoidant. And I don't know if they're total opposites, but I will say that a lot of times what we find is that anxiously attached people and avoidantly attached people, they tend to get into certain relationships with one another, not just romantic, but just relationships in general. And then it almost kind of reinforces each other's stressors. It's like they're triggering each other in many ways. But people with avoidant attachment, they tend to have one or more of these self statements. I'm only as good as my last achievement. I must be in control at all times. I keep others at arm's length. And when the going gets tough, I go it alone. So again, if your operating system involves one or more of those self statements, you're much more likely to avoid dealing with emotional conversations, derive your self worth from your achievements and your goals, and become more of a workaholic in many ways. And also, when you are stressed, you don't let anybody else know about it because you don't want people to see that as a weakness, that, that somehow that might mean something about you. And not wanting people to know that because you want to seem invincible to the people in your life.
It's interesting what you said about the idea that folks with avoidant and anxious may end up with each other. And what I'm imagining is kind of an oil and water situation where it meets some needs, but it absolutely probably contributes to a flare, if you will, of this attachment style.
Right. Absolutely. And I think until you realize that, again, this doesn't mean that these individuals can't be in good relationships with each other. They absolutely can. But it's more about, recognizing that these are my patterns, and perhaps I might be triggering a similar pattern in someone else. And kind of being able to have that conversation with a person who's important to you and say, how can we move towards a healthier way of connecting with one another so that we don't keep re-triggering and bringing up the same issues over and over again. Yeah.
And let's stay with insecure. So moving from anxious into avoidant, let's talk about disorganized. What are some of those self statements?
So when we talk about the disorganized attached, some of their self statements might sound like this: I deserve to suffer. I hate you. Don't leave me. I can't control my emotions. And my life is in constant chaos.
I hate you. Don't leave me. That is the title of a well-known book associated with diagnosis of borderline personality disorder. I think for many folks, disorganized attachment can be easily associated with personality disorders. Can you speak a little bit about that?
Yeah, I think that it's easy to kind of say that because, as we mentioned before, people find that disorganized attachment, again, somewhat due to pop culture and just their own beliefs about this, that it's not able to be changed. It's something you just have to manage and deal with. And I think that's how it became associated with personality disorders in the first place. That, and also sort of like a more chaotic interpersonal style where maybe you just can't predict how they will respond to stressors. But I don't think that the disorganized attached individuals, really are at so much more risk of developing personality disorders per se, or that really even should be an association. I think it's really just about learning that these patterns are not working, and being able to disengage from them rather than labeling people with a personality disorder.
I appreciate that comment there at the end. The whole concept of personality disorder is such an interesting one when you consider that personality, not only an element of it that is genetic and epigenetic, but also is in response to our environment. So how could it possibly be disordered effectively if it became that way in order to keep ourselves safe? Like, that to me sounds pretty adaptive. You're smiling as I say that. Tell me what what
Yeah,
you're
I feel
thinking.
like it's absolutely true. It's really just us trying to survive and to thrive. And so to try to put something on that as to make it pathological, I feel like we're really doing ourselves a disservice. And that's where all the stigma comes from. It's like, well, you're intentionally doing this to rile people up or to cause chaos. It's like, no, we're just trying to seek safety. That's what we're all trying to do, and maybe not all of us can communicate it as well as everybody, as others, but that's what we're all looking for, is just safety and security. That's our base level of need that we're all after in one way or another.
Thank you. And now into secure attachment, what are some of the self statements associated with
Yeah,
that?
so someone with secure attachment might feel like one of these or more will resonate with them. I believe in and like myself. I can handle what comes my way. I can affect positive outcomes in my life. I can be independent and rely on others too.
Growth mindset.
Growth mindset. Exactly. Yeah. Yeah. And that's the thing, people who have secure attachment, their lives aren't perfect. They're going to make mistakes. There's going to be times where it's like, well, why did I do that? I really wish I didn't. And, they're going to have feuds and anger with people in their life. But it's just about that resilience, that this feeling of resilience is more built in. I can overcome what's going on. Like, this is tough right now, but I can still do it.
I have a question that may be going out into the weeds. So I invite you to shoot it down if you want to. As we're talking about these different attachment styles, I'm also thinking about adverse childhood experiences, ACEs, and any research that has said basically these traits make it more likely for someone to, recover, being a relative term, but to integrate these adverse childhood experiences. For folks who are in the language of ACEs, how do you see ACEs coming into play with attachment style, and does it impact what treatment interventions we might
Yeah, I
use?
do think that ACEs have a lot to do with attachment style, and specifically about, there's a lot more relationship to disorganized attachment, only because that one is more associated with, chronic stress or even trauma. Um, and I think that just understanding that is a huge part of it, because I think sometimes people will say, um, just as children often do, they blame themselves for the things that have happened to them. And it's like, it's my fault. Something bad happened to me, and it's my fault. I caused it somehow, or I'm damaged somehow. And so it is important to pay attention to the ACEs, and then to educate people, to educate your patients and say, you know, this is not your fault. It happened at a time when you didn't have the control and agency, but as an adult who does have more control and agency, you're trying to make sense of what happened to you in the past. So it kind of feels like you should have done something different. But like, this is your adult self saying, if it was me today, I might do something different. But as a child, you didn't have that kind of power and control over your environment. And I think that that's oftentimes part of the work and unpacking the trauma is, again, people go back and revisit trauma, and they'll say, oh, well, if at that time I just said no, or like told somebody sooner about what was happening, and they beat themselves up over it. And it's important just to educate and say, ACEs happen at a time when you're not able to fully cope and deal with it the way that you would as an adult. And so, being able to relieve them of that kind of self-blame is a huge part of being able to even to help guide them and do that work, because that feeling of shame just really precludes you from reaching out for help or thinking that you can actually do something to better your situation.
Thank you. I appreciate you breaking that down. When thinking about these different attachment styles, one of the things that has particularly interested you is a term from decades ago of reparenting, For listeners who are not familiar with the original reparenting movement, can you give us a quick 101
Yeah,
about
it's
what
so
that
funny,
is?
right? I feel like it's definitely getting like a little resurgence. Yeah. Like it was something that we talked about, long time ago in this field, and then now it's kind of coming back because it feels like it's applicable. But reparenting, really very simply defined, is just meeting the needs of your metaphorical little you, your inner child, and being essentially the parent for yourself that maybe you didn't have as a child. And this is not about blaming parents for what they did or didn't do, right? But it's more about, hey, as an adult, you have the agency to create more effective coping strategies, to have more positive outcomes, and we want to be able to embrace that. And sometimes people hear reparenting, they're like, whoa, that's like a woohoo concept. This is not something that makes sense or might be scientific, but actually there is a lot of evidence base behind reparenting. And it's associated with really small intentional acts that we all can do on a daily basis just to be able to honor the needs of our inner child a little bit more, and just to show our inner child that, hey, we're listening to you, and we're here, and we're going to help you to manage your stressors better, and to attack life's challenges better. And really, reparenting to me is about developing a secure attachment with yourself, right? It's like that's the first person, the primary person you need to develop an attachment relationship to is you. And so many times we're so unkind to ourselves, and we treat ourselves in ways that we would never treat other people. And it's just a reminder of, how can we be more gentle to ourselves? Like, picture a baby, picture an infant. They're completely helpless. They're completely innocent. What could you do for that baby? What could you do for that infant version of you?
That was a great synopsis of this idea of inner child work. And I agree that so often the phrase like inner child is associated with this kind of fringe concept, but it seems somehow more acceptable if you put it in the language of attachment.
Yeah. Yeah, exactly. And I don't really know why it's such a fringe concept. I guess I feel like maybe the issue is that people see it as, in my mind, I think, oh, it sounds woohoo. Like, even inner child work sounds a little woohoo too. It's like, oh, like, what does that mean? But I think that it's important to recognize that we all needed caregivers, right? Just like as a social being, and the way that mammals are built, we can't take care of ourselves. Like that is literally impossible in the first years of life. And so it's a necessary component for our existence. And I think that maybe that will help people to just like understand the connection a little bit more, is like, whether it's a birth parent, an adoptive parent, a caregiver who wasn't related to you at all. Like, we all needed caregivers. Like, that's just a basic necessary ingredient of life for human beings.
So often when we think about attachment, we're looking at it through the lens of this isolated relationship between caregiver and child. And I think some of that has been challenged in consideration of the circumstances around a dyad of caregiver and child. So I'm thinking about the pandemic and how you had so many parents who were working from home or extremely stressed about finances, housing security, circumstances that were greatly beyond their control, fear for themselves, for their children, for their other family members, and how that's impacting attachment. And I had a conversation recently with a director of a childcare program, and she was saying, the kids are really different now. Like the kids are very different of what I'm seeing of these children who were the pandemic babies coming into childcare. And it's an interesting concept to think about these changes in attachment that are directly related to events, not necessarily to even parenting styles, but to these situations beyond control. Can you speak a little bit about those kind of elements that you can have a very well-intentioned parent who is also depressed, a well-intentioned parent who wants to have secure attachment with their child, but can't because they're having trouble making ends meet, whatever challenge may be coming to them.
Yeah, I think that if it's a parent who is struggling with their own uh, their own emotion regulation, their own ability to focus on self actualizing. That's very, very hard to try to get that parent to take care of another person's well being when their own well being is so at stake, it feeling like it's such a precarious situation. And so, again, this is not about so much of this is about recognizing that we're all trying to do our best most of the time. Of course, there are that small population of parents who are just like truly heinous, abusive parents and like they're intentional about it. And that's terrible. But for the most part, most parents are trying to make ends meet to do the best that they can with what they've been given. And it's also important to recognize that there's a aspect of intergenerational trauma as well, where, they just don't know how to be a more quote unquote helpful or effective parent because they never learned those skills in the first place. And they're just trying their best to do that now with what they know. And their intentions are in the right place, but they just can't execute it in the same way.
I'm glad you brought up the generational piece. So, thinking about that aspect and this idea of reparenting as a tool to do inner child work, heal some of that attachment trauma, and move forward into healthier, more stable relationships. For somebody who has been in a chaotic environment, let's take disorganized attachment as an example, grown up perhaps in chaos and trauma and neglect, their nervous systems are constantly in overdrive. You had mentioned kind of needing to calm some of that. I imagine you would need to get that stuff settled before any idea of reparenting is even possible, because as you already mentioned, kind of self-actualization, you can't get to that stuff until your basic needs are met and you can calm down enough to feel
Right,
safe.
exactly. And so if you can't regulate your own nervous system, how can you help to regulate another person's nervous system? And so it is about meeting those basic needs, disengaging yourself from fight or flight when it's not needed, because fight or flight as a system, this is not meant to be something that you access on a chronic basis. It's supposed to be something that's like a one off. You do it for a little while. And then you come back and you get to be in the rest and relaxation phase. That's how we're built as humans. We're not meant to be in chronic fight or flight, but so many of us are now. And so it's really about being able to find that peace and restoration for yourself before you can, get to some of those other aspects of like caring for somebody else or like actualizing into higher goals.
When you have a client who has developed over time insecure attachment, I'll let you choose whatever kind you want in this case example. What are the interventions that you're reaching for once you've done some of that stabilization work? So when we've, helped the person create theta waves in their lives, we've helped them perhaps develop healthier habits around sleep, around eating, around relationships, exercise, things like that. When they're in a state of stability, where does, or not even where, how does the work begin to help get in there and kind of heal some of this stuff that's potentially decades old?
Yeah. So I think it's about, shifting your life into a self concept that is more balanced and includes more of a multifaceted approach to how you see yourself. Insecure attachment leads to kind of very, very isolated and one off versions of who you believe you are. Like when I do a self concept exercise with people with avoidant attachment, oftentimes they define themselves mostly by, their achievements. People who have anxious attachment, they tend to define themselves most by um, their relationships with others or like how others perceive them. And so it's really about rounding out even your self concept. That would be a first important step of, let's honor all the different parts and different facets of myself. Because then if something goes awry in one area, I have these other areas to help me and to bolster how I feel about myself. I also think that turning to values-based work is going to be a really important aspect of this. And, what are the most important things to me that can't be checked off of a to-do list? And how do I embody that a little bit on a daily basis?
When thinking about clients who have a more disorganized attachment style, I think one of the difficulties is how entrenched patterns might be. And it's a big ask to recommend that somebody do something differently. I know that's been one of my experiences clinically. And I think that's true of any insecure attachment style, but particularly with disorganized, even a 1% shift can feel terrifying and monumental. How do you work with that resistance that someone might have? You mentioned like values based work. Is it a lot of motivational interviewing to kind of try to develop the motivation and the resilience to try this new thing, to say hi to somebody at the grocery store, or whatever in that moment feels like a big risk?
Yes, definitely. I think that it can feel really big if you're trying to think about, how far you might have to go or like how long it's going to take when you see the more radical shifts. And I would just invite people to say, what can I do today? Like what's one small thing I can do today to move this in the right direction? So it's not so much about, feeling like you have to get everything done all at once. And it's also just really about learning to go one small step at a time, as opposed to, thinking about that big picture every single day. And that can be sometimes hard for people. I think it's like, well, then what's the point? It's like, well, but every small little thing that you do is going to move the needle a little bit. And you're going to start to see those shifts, even on a daily basis, as you're moving towards that bigger picture of, okay, like, how do I get to secure attachment?
When you're working with clients, are you providing this exact language? Are you saying, let me tell you about the different attachment styles and here's how we're trying to move the needle from anxious into secure and here are the
Yes,
benefits?
I actually do really spell it out clearly for them because I think it is important for them to know, um, kind of the path of where they're going and also to know their attachment styles, uh, to be able to understand maybe what's unproductive in their life at this current time. And I think that, the insecure attachment styles are not necessarily to label and to make them feel pathological. And actually, in my book, I even talk about some of the positives of each of the insecure attachment styles because there are positives. It's not all doom and gloom all the time. It's just, aside from the positives, there can be some negatives that really hold them back from doing the things they really want to do.
Can you talk a little bit about some of those positives? I'd love to hear
Yeah.
them.
So I think, people who are avoidantly attached, again, people tend to admire them for how much they can get done in a given day. They tend to be really goal directed and goal driven, and self initiated. And sometimes people really see that as an admirable set of qualities. They oftentimes, if they say they're going to do something, they come through. They say, I'm going to make this happen today, and it's going to happen today. People who have anxious attachment, they tend to be so aware of how other people are feeling. They tend to be more empathetic than the average person, because they're a little bit more interpersonally sensitive. So they have that kind of same grace for others. When you want to call on someone for support, they're almost always there. Obviously, oftentimes at to an extreme, but they're always ready to roll up their sleeves and try to help. People who have disorganized attachment, I call these people surveillance specialists because they're constantly kind of scanning the environment for what could be something that's dangerous or problematic. And those skills can be really important in certain situations. And a lot of times, they will actually go to bat for the people that they really care about. They'll really show up in very, very helpful and consistent ways when they have anchored themselves to a person. And so there are some positive aspects to all of the insecure attachment styles.
Thank you. Um, Earlier, you and I had talked about the difficulty of moving from insight to kind of where the rubber hits the road. What are some other pieces of insight you have for clinicians who are listening? Because I know even for myself, sometimes it feels like we swirl around the insight and it's like and then what? So I understand why I do the thing, but I'm still doing the thing.
Right, exactly. Yeah, I think that a lot of people probably they feel like, okay, the insight-oriented work, that's important, but how do we move this to the next phase in a way that feels digestible to the patient? And I think that if you are able to say, okay, now that we know these patterns, what's something that we can do to work on each of these self-statements, starting with the one that feels most like it resonates with you the most. And so, for example, if we're talking about working with a disorganized, attached patient, and they're, the one that maybe resonates with them the most is, I can't control my emotions. Then it's like, okay, well, how do we work on healing that and unpacking that and creating a more balanced core belief or a more balanced self statement? And perhaps the balance comes from just teaching them one emotional regulation strategy and assigning that as homework in between sessions, doing something that's tangible that way that really helps to unpack that particular self statement and reduce the negative impacts that it's having on that person's life.
When it comes to reparenting, the idea being that we're pulling from a good enough parent to heal circumstances where we didn't have a good enough parent. I've had the experience that sometimes people, clients can get stuck in like motivational posters, if you follow, where it's like you can do anything you set your mind to, or like shoot for the moon, and if you miss you'll land among the stars, like to get into this idea of like, well, I just need to say enough positive mantras and I'm going to be able to change my perspective, and that's going to change my behavior. How do you respond to that as someone who is actually like in the attachment world and doing the work? Because I think it can get boiled down to something that becomes unrealistic.
Yeah. I think that, you have to check sort of your own expectations of yourself. It is important to try to find somebody else who can like also help you do that check. Cause I think we get unrealistic sometimes when we're too into our own thoughts and we're not taking just, a little bit of feedback from our environment who can say, hey, like, let me help you to try to reshape this in a way that makes the most sense, that isn't going to be too overreaching. I think so many times we have a hard time doing that, probably because obviously we want the best for ourselves. Obviously we want to be able to achieve more in our lives. But if you rush so much into it, you're actually going to self-sabotage because no one can like live up to those kinds of huge expectations. And so I think it is important sometimes to, go to one or two trusted sources. And for someone who's starting their attachment work, maybe that trusted source is their therapist, to start with, as opposed to somebody else that's in their personal social world. But just being able to help like recalibrate what those expectations are in a way that is going to be more helpful and productive.
I'm glad you brought up this idea of therapy and where therapy fits in. If we look at Rogerian therapy, for example, this really person-centered approach, I recently had the conversation with a client that our lives may give us opportunities for corrective experiences. Um, Therapy being one of them. Can you speak to that and kind of the importance of clinicians effectively being good enough parents?
Yeah. Um, yeah, I think that, there's a couple of things that come to mind. One is when you're doing attachment work with your clients, you very well may be essentially acting in a parental role with your clients so that they can first form a secure attachment to you and then help them to start doing that with other people in their life. So there is this aspect of you essentially carrying a little bit of that burden and that responsibility of being an effective parent who your patients can attach to in a secure manner. And that does involve you also understanding your own attachment styles. I've seen some research studies about how different attachment styles interact with one another, between therapist and patient. And so it is interesting to kind of have to do some of that self work and to know, where some of your own blind spots are to be able to be the most effective therapist. But I also think that in your own personal life, that's another place to practice and model secure attachment, not only with the actual children in your life if you are a parent, but also just thinking about how you can do that for yourself and also for the most important people in your life. And secure attachment bonds can be created at any age. It's just that as a child, they tend to stick with us for the rest of our lives. But it doesn't mean that as adults, you can't, reopen that process and be able to cultivate secure attachment from adult to adult. And that really is what so much of the work is. And as therapists, I do think that we have sometimes more of the burden of the responsibility to start that work first with the people in our lives.
If you had a client who was really motivated to tackle this and they want to do work on it outside of the therapy room in addition to therapy, what are your recommendations for how to do that?
I think if you have a client who's really motivated and they want to do things that they can practice on a daily basis, even outside of the therapy room, it's helpful to have, a workbook. It's helpful to have some guide. My new book has a lot of daily exercises. I also am aware of other books, like attachment style workbooks. One of them is actually by a licensed therapist, Annie Chen. She has an actual workbook on healing attachment styles, which I think can be helpful. And so perhaps for those really motivated clients, they might benefit from some of these guides and books that actually have tangible exercises within them. And then they can come back with you when they're in session to share their learning or to maybe clarify an exercise or ask for an extension. So I think for those more motivated clients, this might be a good approach.
Thank you. I appreciate that. In this hour that you and I have spent together, we've talked about the different attachment styles, introduced the idea of reparenting, and some of the interventions that might be helpful for clients. What are other things that we haven't talked about that you feel like are really critical to bring up in our time together today?
I think maybe the most important thing is just realizing that no matter what age and stage you are in your life, you can heal your attachment. So if you find that the negative impact of insecure attachment or some of those negative self-statements and core beliefs are starting to really show up in your life in unproductive ways, it's never too late to start the work. And I think that that's an important thing to mention to your clients who might feel a little hopeless or say, like, this has been going on for so long. Like, what's the point? It's like the point is you can start at any time.
Thank you. And how about any research related to transitioning from insecure to secure attachment? Like, is there anything that you've seen specifically about how long that takes, about any ages or opportunities in life that may either help or hinder
Yeah, I
that?
think most people will start thinking about attachment when they are at various life transitions, because, like, in those kind of circumstances where there's like a novel environment or experience, that's when some of the insecure attachment wounds will come back in the hardest way. And so I think that at some point it might feel a little bit more overwhelming in some ways to like start that work then, but it's also the best time to start that work because you're going to be the most driven and most motivated. In terms of research that suggests like how long it takes to shift attachment styles, I'm not aware of like a uniform recommendation or a pattern, but I do think that just based on my work with my patients, people can see shifts in how they respond to things pretty quickly, like within weeks. But it doesn't mean that all of those patterns will be significantly reduced or eradicated. It just means that you're going to have that much more self-awareness, and that in some ways will help motivate that person to continue on in that work.
You had mentioned the nervous system dysregulations, particularly associated with disorganized. With anxious and avoidant, are you still using interventions like mindfulness to try to cope with insecurity, anxiousness, fear, things like
Yeah,
that?
absolutely. I think mindfulness just applies across the board, even for people with secure attachment to hone. Um, if we could just slow down enough and just take in our daily moment to moment experience, it can do so much in terms of just helping us to make decisions that we're not going to regret, um, feeling like we have more agency and control over different aspects of our lives, and then also just appreciating the moment for what it is, because this moment will never come back again. So, just really living life, with that kind of vision and with that kind of attitude can really help you to have more joy on a daily basis too.
And in your work, talking with clients about attachment styles, I know one of the things that I have seen in my work, and I'm curious for yours, when people maybe have self-identified, oh, I have anxious attachment or I have disorganized thanks to TikTok or Instagram or whatever it is, and it's like, this is who I am. It's been interesting for me to say, well, these were things that you used to do, but may I point out something that you did recently that wasn't anxious or that wasn't disorganized, and talk about that. Do you find that that's something that you have experienced too? That the kind of this steadfastness about, this is who I am, this is the way I'll always be, and then potentially gently pushing back and pointing out exceptions to that rule?
Yes, definitely. I think that again, the idea of a pre-existing self-belief and how much people are invested in that, even when it's not working for them, is so huge. But that's because our brains are more comfortable with pre-existing ideas and information, and it does take a little bit of time to kind of like push it out of that in a way that feels constructive and helpful. And so you have to kind of meet the client where they are. If they're not totally ready to confront that, like you said, it's about that gentle pushing. It's about maybe creating a little bit of a discrepancy between what they say and how they're behaving, or what they say they want for their life and what's actually happening. And then saying, well, could this be part of the reason why you haven't actualized in the way that you want? Could this be the reason why you haven't found as much meaning in your relationships?
One of the threads that I've taken from this conversation is the injection of a lot of hope. Because I mean, I'm thinking about conversations with insurance companies, even talking about certain personality disorders, and they're saying, well, but this person has always been this way. And so this is just how it's going to be. They're going to have chronic passive suicidal ideation. And me saying, wow, it's really interesting that you, insurance company, are making this assertion about this person's future. And I appreciate what you're saying here, which is, we can work on this. And I think that's an important message for clinicians to hear, this idea that we are the holders of the hope of like, this can get better. You can be in relationships that aren't neglectful. You can be in relationships that aren't abusive. You can go to work and not lose as much sleep if something happens with your boss or with your colleague. I think just that is a really important thing to keep in mind, that people are capable of change even for these things that feel pretty
Yeah,
entrenched.
definitely. And I think for most therapists, who are listening, if you didn't believe that, obviously you wouldn't be in the profession that you're in. But it's also about getting our patients to understand and like really hold that concept of, like hope. Hope is not wasted on something like this. Even if it feels like it's been a pattern that's followed you for so much of your life. There's always hope. There's always hope for change. And, as long as you have a pulse, there's a possibility that change can happen, like as long as you have this life and for however long you have it for, you can make positive changes in your life.
Thank you again for joining us, Dr. Judy. It's always wonderful to have you. For our listeners who want to learn more about you and about your work, what's the best way to do that?
So you can find out more information about me and also get free resources at my website, drjudyho.com. And you can follow me on social media as well at Dr. Judy Ho.
Wonderful. And your book, tell us a little bit about that. And you had mentioned like there are some workbook features in that, but you can tell us a little bit more about your book, please.
Yeah, so the New Rules of Attachment is a really hands-on, practical guide. It gives you a lot of explanation about attachment theory, how it might be affecting your life in different ways. But it's also very prescriptive in that there are practical and tangible exercises and tools for each insecure attachment style, as well as tips and guides and exercises on how to continue to hone or cultivate your secure attachment style. And so the design of the book is to be done, on your own, even without a therapist. But I find that a lot of people will find the work to be helpful to be done also in conjunction with a therapist. And so the idea, though, is that with one or two exercises a day, you can really start shifting your insecure attachment wounds.
Thank you for sharing about that. I was wondering, like, is it clinician guided, uh, or geared, I should say, or is it more for lay people? And it sounds like you find it to be a helpful resource for people wanting to do that work outside of therapy, just for any of us who are interested in attachment and working on our own attachment, and then helpful to come into therapy and work through those things.
Yes, exactly. And I would say that, especially if an exercise feels like it's a little tenuous or you need a little bit more of an expansion, that's where working with a therapist can really help with unpacking some of the maybe more complex or challenging exercises.
Wonderful. Again, for our listeners, we've had the opportunity today to hear from Dr. Judy Ho. As she said, please check out her website. Thank you so much for joining us again, Dr. Judy. It's been lovely to spend this time with you.
Thank you. You too. Thank you so much for the great conversation.
You've just finished listening to another exclusive Continuing Ed podcast by Clearly Clinical. If you like what you just heard and you need Continuing Ed credits, please visit us at clearlyclinical.com to check out our one-year membership, where you'll have access to our growing library of Continuing Ed podcast courses. Clearly Clinical, where our goal is to help you learn, grow, and shine.